And for more on the situation in New York and the United States, we welcome Director of Global Health in Emergency Medicine at York-Presbyterian and Columbia University Medical Center, Craig Spencer, to the program. Thank you very much for joining us live on France 24. I'd like to start by asking you what the morale is like in New York, in particular for medical staff.
Thanks for having me on. Yeah, morale it's complicated, right? So many of us feel this moral obligation to be going into work and knowing that we have the skills to save lives and to help people on a daily basis. But as you're hearing, we're starting to get through this, and a lot of people are both physically exhausted but mentally exhausted, working long hours, seeing things that many of us haven't had to experience, making decisions that many of us never thought that we, in a country that has, the highest per capita spending on healthcare in the world, that we would never have to make. You had mentioned the concerns around a lack of ventilators. You had mentioned the concerns around a lack of personal protective equipment. We know that as case numbers continue to climb here in New York City, we're going to be faced with more of those difficult questions. And we also know that we're really just the first step in this virus's march across the country. And so many of us have concerns about how this is going to impact medium-sized cities, smaller cities, rural areas, where the specialist capacity, the intensive care capacity just isn't anywhere similar to what we have on the coast and in our big cities.
If we focus solely on New York for the moment, there are reports that Governor Cuomo is unhappy with the amount of federal help he's receiving. Some have described the situation of lack of equipment, which you've just mentioned, as a national shame. Would you agree with that assessment? What help does New York need the most now?
Yeah. I'm not a politician. I'm a public health professional and a physician on the front lines. What I'm seeing is that we need all of those things. We need more personal protective equipment. We need more ventilators. We need to be prepared. What we know is that China tried to warn us and we didn't listen. Italy tried to warn us and we didn't listen. New York City right now is doing what it can by getting in a Navy ship and setting up field hospitals in Central Park. This is absolutely incredible. I think we've done a lot in the past couple of weeks. But we're going to need to do a lot more here in the city to be absolutely prepared for a big increase. And more importantly, we're going to need to think about how we take and funnel this learning into the rest of the country, where this virus is certainly going to go next. And
of course, you've just mentioned once again that that heeding signs weren't heeded, warning signs weren't heeded. New York City is the most densely populated city in the United States. Does this mean that, unfortunately, the situation is likely to get a lot worse before it gets better?
It really depends on how serious we are about preparation. The one thing I've been saying is that I survived Ebola after working in West Africa because I was treated here in New York City. I had great care. We know that those resources don't necessarily exist in many other places throughout the country. And the other thing I think that's important, being on this program, I speak so much in the U.S. and I talk to so many of my friends internationally. This isn't just a U.S. issue. This isn't just a France or Italy issue. We need to be talking about the impact this is going to have on vulnerable communities all over the world. I spent a lot of my time working in West and East Africa. I have friends in Burundi, a country that doesn't have a officially reported case now. They don't have access to gloves or running water. The impact is going to be huge, and it's important for us to not only think inward on how we prepare, but outward and thinking about how we can help people in other places around the world where the impact will be magnitudes greater.
Craig Spencer, thank you very much for joining us live on France 24 and for those explanations. Thank you.